Hi, thank you for watching my presentation on evaluating staff performance. My name is Catherine Saladki. Evaluating staff performance is a pivotal process and an opportunity to grow and develop staff. It really helps to enhance the workplace environment and staff satisfaction, as well as physician satisfaction and the care of quality that we provide patients. The evaluation process is a high-functioning unit free of performance issues, resulting in the most cost-effective healthcare. A unit free of tardiness issues, abuse of paid time off, and bullying produces turnover, which in turn is making a business expensive to run. We've all worked on units and or been in a healthcare profession where our staff or coworkers don't show up to work, and it can be very challenging. There are 5 components of annual performance evaluations: multifaceted behavior-oriented criteria, feedback on the level of performance of criteria, again, a rating scale, concrete examples of performances or lack of performance, staff member self-evaluation performance, and developmental plan for performance improvement. As a manager in this area, I have been through many employee evaluations. It is so important to make sure that nothing in an employee evaluation comes as a surprise to the employee. If there is a performance issue, the employee shouldn't be hearing it for the first time in their annual review. Performance management. There are systems, policies, procedures, position descriptions, and evaluation components that are essential to providing consistent, high-quality nursing practice. It is key to successful performance management in a setting such as the ABC model, according to Sullivan. The ABC model is A stands for antecedents, B is behaviors, and C is consequences. Daniels and Daniels calls the ABC models the tangibles and intangibles that prompt behaviors. That is the antecedents. B stands for behaviors, what a staff member says and does, and C are the consequences, when you are doomed to fail because behavior will never change or is very challenging to change. At the unit level, a manager who does not use the ABC model will generally not be successful in improving unit performance, according to Sullivan. There are different methods of collecting performance data, and one of those methods is the peer review. A nursing peer review is making sure that your coworkers are working up to the best of their ability. You are basically scoring them as you would score yourself on an evaluation. This can be really challenging to do as a nurse, peer reviewing an individual or someone that you work with, but it can be really helpful on the management level to have a better understanding of peers and who's really following quality and complying with policy adherence. Another method of collecting performance data is self-evaluations. Self-evaluations can be really uncomfortable to do. No one really likes to brag about themselves, but a good idea for self-evaluations is to really keep a list of items that maybe you've done and a kudos list for yourself throughout the year. So when it comes time to do your self-evaluation, you can recall specific examples of what went well and what didn't go well in your nursing career. This can be intrapersonal factors, including the characteristics or your education, your coping strategies, anything that's related to your interactions with patients and or staff members, and your ability to provide direct patient care. Also, another method of collecting performance data is your skill competency. In nursing, it's usually your skill competencies are the requirements to be completed before you can even have an employee evaluation. It is the ability to perform your skills knowledgeably and safely. And the healthcare organizations have trained validators that will watch certain clinical tasks and skills being completed by the nurses, deeming the nurses or medical assistants, whoever they may be, competent in certain clinical skills. The manager plays a key role in determining the competencies required for each position. It's the manager's discretion as to which competencies are required for each specific unit that the nurse may work on. Management has a huge responsibility in taking care of their employees, really being present and visible on the unit on a daily basis, providing concrete examples of performance and setting the example of those performances and what are expected of nurses, coordinating one-to-ones on a regular basis with staff to touch base with them routinely. Communication is such an important aspect of how an office or a unit is running, coaching the staff in how to complete a self-evaluation, and consistently following policies and reviewing policies and procedures with staff. The most important thing as a manager is that there's always a support team behind management. So if you are a manager, human resources, your boss or a mentor or a seasoned colleague are always available to assist. A manager should never feel alone completing employee evaluations. They can be very challenging sometimes, and many people feel really uncomfortable completing these. I often say to keep your own happy list in your email and add to it during the year for your employees, just as you would tell them to do for a self-evaluation. And it's a good recap and helps you to remember specific examples that you can call out for employees that make the evaluation a more personable experience. There are some challenges with performance reviews. As I said, they can be just challenging in general for both parties involved. The majority of competency evaluations in nursing are still being conducted via self-assessments, which is pretty surprising. Accurate review helps to promote the attainment and improve the care and patient quality outcomes in healthcare delivery. So there really truly is a big understanding that these do have good patient outcomes when they are done appropriately. When you're completing an annual performance review, the goal is to really create a safe environment. Go through the ratings one by one and ask the staff to respond to the ratings, encouraging questions, deciding on specific ways in which performance areas can be strengthened, even setting timelines for items that need to be worked on for completion, creating the action plan, and then following up and evaluating the process, asking for feedback. Again, performance reviews can be really challenging to quote-unquote grade someone's work performance in their own career. It shouldn't be taken lightly, and it is extremely important if there is an issue that there are examples to back it up so that the employee can understand how to improve. And again, it shouldn't be first heard that there's an issue in an employee evaluation. Deciding on specific ways in which performance areas can be strengthened is very important. And as I said before, asking for feedback from your employees is very important as well as creating that action plan and evaluating how things are going. In conclusion, as I said, creating a safe environment when completing a performance review is very important. Going through ratings one by one, asking the staff to respond to those ratings, encouraging questions, and deciding on specific ways in which performance areas can be strengthened. Set timelines for items that need to be worked on for completion, and create those action plans and evaluate the process and ask for feedback. Again, reviews are very challenging. They shouldn't be taken lightly, and it is important that if there is an issue, that you're always in communication with your colleagues and staff members because they want to get better. They want to improve their skills. Thank you for watching my presentation, and these are a list of my references that I used.